Well, here we are,
Hello.
sunny Napa. Behind us is the Culinary Institute of America.
Before us is the most beautiful garden that reminds me of a palace garden in Scotland.
It's surrounded by us. As you can see, the conference is packed. Actually, everyone is in class right now, but I had an unexpected commitment to attend to for a meeting this morning, so we had a nice walk through town today.
And yeah, it's been pretty amazing. I'm learning a lot.
Tell me, what's been one of the important takeaways so far?
I think that learning about planetary and personal and community health was cool.
Yeah.
And then also there was a lot of talk of medically tailored meals and groceries, which is really inspiring.
Right.
I feel like that is what I do for myself, like a diet for when I'm having acute stress, a diet for if I didn't sleep enough, like just knowing what foods to take, and also just food as medicine. They're really discussing that a lot as it relates to the reimagination of healthcare.
Right. I think for me, and I think I'm gonna just say this and then you just say yay or nay. I think we've been winging it in the sense of we intuitively have been bringing forth what we feel about medicine, connection to family, patients through food, and have been involved in our own little micro pockets of learning or things that we share amongst us. I did not do a deep dive into the conference. I came with no expectations. And I would say what I take away from day one is it literally has hit on everything you and I have been saying individually in a validated structure between Harvard, Culinary Institute of America, and 20 plus year history to get to this point. Fair, yay or nay?
Yeah, I think so. I think the first day was a pretty good rendition of all the topics that are near and dear to us.
Right.
So we're in the right place right now.
Yeah, we're in the right, yeah. And I think also the empowerment of health and culinary professionals to actually deconstruct the mismanagement of medical education in the way it relates to nutrition, right? So this emergence of the teaching kitchens, we're hearing from these amazing chef physicians, only double board certified, triple board certified.
I consider myself a physician, even though I didn't go to culinary school, but like my culinary school is in my kitchen.
Yeah, I appreciate that we're never too old to have mentors. We're never too old to have people bring us up on new skills. And so it's just been awesome to see my first cohort identified peer as a physician, and to see that people have forged, pun intended, forged a path. So yeah, it's been exciting. And I think, again, just the understanding that one of the most profound things to me was the way that culinary education, nutrition needs to start at the pre-med level.
Yeah, I think they really nailed that in. And also the demos. We've been getting some cool demos. Like right after they give a talk, they demo a really quick and easy recipe that's been really inspiring.
Right. Yeah, you watch actually a chef cook their meal. And I think part of this is while we feel like, I'm not Gordon Ramsay. Well, maybe my attitude sometimes, but we're comfortable in the way we cook. I think it's been really helpful to just see some of the simplicity brought forth, in that when you're discussing kale and why you should eat kale, you have to make it palatable. And to watch an expert actually prepare a kale salad in front of you, I think just really hammers home that message.
Yeah, definitely. And also just like, I think a lot of the focus is plant forward, which, I love plants.
Yeah.
I'm a plant mom. And so I think just also encouraging growing, that's been a theme that is important to me. And like you said, I think we're reimagining, and there's a lot of things in the works to really recalibrating the priorities. Because while the previous educational system may have served us in the past, I think things are changing and we need to upgrade.
Right. Yeah, it's been fascinating. We didn't talk about this last night. I think one of the other things that's been really interesting to me is the balance of the civil servants who are experts, who have to navigate a cautious line as civil servants and employed by the NIH or government, in being objectively presenting differences for health policy that doesn't align with best practice. And I think one of the most striking things was when the current food pyramid came out, the recommendation from the experts craftedly enhanced the need for protein that were plant-based. So to come back to what you're saying, and it's unfortunate that the food pyramid was manipulated by politics and money.
Yeah, I think they did a pretty good job on day one to describe the updated pyramid and food recommendations from the government level and to go into the pros and cons of some of the recommendations. And I think we'll get more into that today. But yeah, how we'll be able to represent the new recommendations or to balance them in a scientifically evidence-based way. And in a way that actually is easy for people to adopt. Like it's very difficult to take recommendations like that unless it's broken down.
Broken down. But I was gonna say one of my favorite slides from yesterday, and I won't remember the statistics, but if you use the new recommended dietary guidelines in the way that it prioritizes butter and meat, but also looking at, was she talking about the grams? I forget, but it basically, if you have, a cheeseburger, a glass of milk, and whatever, you've exceeded the number of fat or something. Anyways, but and that's the messaging that I think we're learning to present is when you see information, and we've been trying to present it, when you see information that we know is, pardon my French, bullshit, how do we put it in a visual so that people who are our patients, our communities.
Right. And I think another thing that just came up when you were talking for me in yesterday's first day presentations are how diverse and multicultural and global the teachings were, as far as like meeting the patients where they're at and trying to encourage them to use or to cultivate a memory of food and spices that remind them of their heritage and their lineage. And I do that a lot. And I think that's how I connect with Gilan, and Iranian people do that to maintain their culture. And I just think that's really important. So we don't, just because we're in this country doesn't mean we have to follow the country's recommendations. We can look at all the diets across the world, like Japan, how they talked about how Japan has like no obesity. Well, we can look at their food in France. They could look at their food and see what is it that they do and try and meet the needs of the patient, meet them where they're at. A lot of them can't afford, or they can't access, or they can't, they don't have time. So there's
and while demystifying, like I wouldn't automatically jump in and say, I'm gonna cook udon noodles and a beef, and a broth, because to me I'd still be intimidated. One of the cookbooks from one of the physician chefs yesterday, Dr. Shu, I believe was her name. Really, I looked at the recipes last night and I was like, okay, this is demystifying the complexity to cook outside of my, my little Colorado urban roots.
That's a good point. I mean, I love Asian food, but I respect it so much that I don't really know how to approach it. And I tend to fall back to my roots and just cook what I'm comfortable with. But I think that I'm getting a lot of tips like how to cook tofu, because I don't feel like I know how to cook it very well. And I think it's a really important protein. But the one we had yesterday for lunch was delicious.
Fantastic. It was great.
Tofu on stir-fried tofu on top of our salad. And it was great. So good.
My final takeaway, I've been to a lot of medical conferences. I've never been to a conference that started enthusiastic, forward, and empowering with an audience participation level and that excitement. And by the way, there was no cooking going on. It's not like they were using, odors to, manipulate our excitement. It genuinely just felt palpable, the excitement of this collective group of medical and medical allied professionals to navigate this space forward.
Yeah, and I think it just reminded me that I like to be around people who love food and plants, and that's where we're at. So it's like,
for sure,
I can do that. Like these are my people.
Right. Well, I think we could geek on all morning, but we're sitting directly in the hot sun, if you can't see the beads of sweat coming over our brow. And we should probably hurry in and see if there's any leftover breakfast so that we can get on for the day. So thanks for following us on this journey. Yeah, a little update probably coming tomorrow as we synthesize day 2 once it starts. Have a great day, people.